I want to explain about potential anemia and iron deficiency anemia. So, if you have a significant iron deficiency, you may need to take iron not only from your diet but also from medicines or supplement. Many menstruating women have iron deficiency due to menstrual bleeding. Anemia can be determined through the hemoglobin. Even if the patient has various symptoms of anemia, she is often told that she does not have anemia by looking at the hemoglobin level. So hemoglobin is used to check for anemia, but it's important to check MCV. So MCV show the size of red blood cells. So that is average, but if you have the small result of MCV, it means you have deficiency of iron. And then, so MCHC also show the hemoglobin size, but it will be decreased if you have the significant severe iron deficiency. And then, so if you don't have any change with hemoglobin and MCV, I recommend to check ferritin. So in the case of women, hemoglobin level is 12 gram per deciliter or less than. It's just judged as anemia. So MCV red blood cell size reference is 80 to 99, and the MCHC reference value is 31 to 36.9%. So maybe you have the result, and then so there is what can I say, the test result show the standard level, so you can check whether you have the normal range or abnormal. So it's better to have ferritin, and then ferritin shows the representing stored iron. And then so there's a very wide range of the standard level, but 40 or more is required ideal level. And then so ferritin sometimes increased with fatty liver or inflammation. So if you have low level of ferritin, it means you have deficiency of iron. But if your result is over 40, you need to think about that whether you have fatty liver or inflammation inside your body. There are many kinds of symptoms of anemia or iron deficiency. So if you are told you are not anemic, but if you have these kind of symptoms, you need to suspect you have iron deficiency. And there are many kinds of symptoms: sleeplessness, tiredness, stiff shoulders, eczema, frequent headaches or heavy heads, colds, slight fever, hair loss, diminished alertness, frustration, irritability, bleeding from the gums, bruising on the body, chest pain, palpitations, and shortness of breath during body movements, swelling, deformed and cracked nails, fragile and warped nails, lack of appetite, cheilitis, tongue is red and slippery, gets tired quickly, yawns often, has an uneven complexion, whitish gums, want to chew hard things such as ice or rice crackers, tongue irritated by salty foods. I show the case And then, so this is the case 1, and she had a palpitation and easily get tired with uterine myoma, and she had uterine myoma, and then her first test result is this one, and then so she had anemia. Hemoglobin level was lower than 11.3, so she have anemia, and then also she have low level of MCV, and then so her iron level inside blood was low, and then she have iron deficiency anemia, and then I hadn't checked ferritin because from her result she had iron deficiency, so it wasn't necessary to check ferritin. And then so 1 month later she took medicine, and then her symptom turned to be better, improved, and then hemoglobin level turned to be 12.2, but her MCV level was still low, so the level is inside the standard, but ideal level is over 90. So I suppose she have still iron deficiency. And then 5 months later, her hemoglobin level was almost same, and the MCV level was increased. So it means her iron deficiency was improved. And this is case 2. She was 41, and then she gave birth 3 years ago from the first visit. And then she complained in fatigue and hot flashes and no appetite and insomnia. And then she worried she was in menopausal status. And then this is the result first visit. Hemoglobin level was 11.0 and MCV was low, and then iron level was still also so low, and then ferritin I haven't checked this time, and then so she was treated with incremin syrup. That was the medicine of iron, and then oral vitamin C and vitamin B she took also, and then Chinese medicine was also used. And then 4 months later her condition was turned to be better, but this time she had still iron deficiency. Her ferritin level was very low, and then her MCV level was still low, but her hemoglobin level was increased. And the 8 months later, her hemoglobin level was increased, and the MCV level was increased also, and then her condition was better. And then at that time she started to take supplement Floradix, that is the syrup supplement and organic and vegetable supplement, iron supplement. And then 2 years later she visit clinic, and then she have still she had still iron deficiency, so she started to take a supplement again. So even if you are told that you are not anemic, if you have any trouble with your condition, you may be deficient in minerals such as iron, zinc, and magnesium, and so on, even if you are not anemic. If you think the symptoms apply to you, increase iron intake aggressively. Also review your test results. So there are several kinds of to get iron. So the most important thing is you need to think about what you eat, and then so if you have trouble with your condition, it's better to take iron medicine or iron supplement for a while. And then iron medicine have the problem of generating excess active oxygen in the body. So I will tell you about the harm of iron medicine in another lecture. So today I tell about the iron deficiency, and then so important to check your test result, blood test result.